Today we're going to be talking about a common reason why people get dizzy, and that's vertigo. V for vertigo. One of the most common forms of vertigo we see in the office is what's called benign paroxysmal positional vertigo, also known as BPPV for short. With looking at the anatomy of the ear, here's the outside of the ear. If we go into the ear canal, past the eardrum right here, we have this structure that looks somewhat like a snail, and then these little semicircular canals on top. So if you look at this structure up here, these semicircular canals are filled with fluid, and then at the base of each of these canals, if we zoom in, we can see that the sensory nerves are here, the nerve endings. These little tiny hairs in a gel membrane contain these little crystals. If these crystals get dislodged, which you can see here in this bottom picture, these crystals can actually start to float within these canals. As you move your head in different positions, up and down, side to side, and turning one way or the other, fluid starts to flow through these canals. As fluid flows through these canals, it tells your brain what position you're in, and it helps with saying, okay, I'm standing, I'm sitting, I'm looking to the left, I'm looking to the right. If there are little crystals within these canals, that fluid can't flow as freely. Similar to if you have a stream of water, and as soon as you put rocks in the water, the stream does not flow as free. So if there's crystals that are dislodged within these canals, then the signal that gets sent to the brain telling you where you are and what direction you're turning your head gets disoriented. So that's where the dizziness and the vertigo or the room spinning tends to come from, is that the neurological signal is disrupted because the fluid within the canal isn't flowing properly because there's a block or crystal within the canal that's not allowing the fluid to flow how it should. So if that's the case in benign paroxysmal positional vertigo, then what we're going to do in the office is actually a series of maneuvers to help these crystals get back to where they need to be at the base of these canals and back into the gel membrane so they don't get dislodged again.